I'm here presenting a paper on health, hygiene, and well-being. So we are going to discuss some beneficiary point on health, hygiene, and well-being in this COVID pandemic. So we also cover some topics of COVID precautionary safety measures also. First of all, what is health? In WHO 1948, given a language that health is a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. So, by this definition, we get to know that health means it's not that if you are not having disease, you are healthy. For a healthy person, you have to be physically, mentally, and social well being. Mental health is very important aspects in today's world. What is the concept of health? The changing concept of health is biomedical concept, ecological concept, psychosocial concept, and holistic concept. We are taking briefly about these points. First of all, biomedical concept. What do I understand by biomedical concept? It means absence of disease, inadequate to solve major health problems. Major health problems like malnutrition, chronic disease, and accident. Chronic disease, what are the chronic disease which are very much prevalent in today's world, especially in India, like diabetes mellitus and hypertension? They both are chronic disease which severely affect the population of Indian country. Ecological concept. Ecological concept means dynamic balance or equilibrium between man and his environment. What do you understand by psychosocial concept? Psychosocial concept covered social part, psychological part, cultural part, economical part, and political part of health. Holistic concept. Health implies a sound mind in a sound body, in a sound family, in a sound environment is holistic health. Meaning of sound, it means you can understand that sound means relax. That if you are having a relaxed mind, your body is relaxing, your family is sound, means there is no disturbance in family and your surrounding environment. You are living a healthy life. You can say that you are living a holistic healthy life. Now we go to hygiene part. Hygiene is a series of practice performed to preserve health. According to WHO, World Health Organization, hygiene referred to condition and practice that help to maintain health and prevent the spread of the disease. This is hygiene. And in today's world, hygiene is very much beneficial because the first safety measure in COVID precaution is hygiene. Regularly we are saying that properly hand washing and proper use of mask is a part of hygiene. In this lecture we are going to discuss about hand washing and also the use of mask like fabric mask, medical mask. We are going to discuss about them, how to use them and how to discard them after use. Many people equate hygiene with cleanliness, but hygiene is a broader term. It includes such personal habit choices as how frequently to take a shower or bath, wash hand, trim fingernails, and wash clothes. It also includes attention to keeping surface in the home and workplace clean, including bathroom facilities. Some regular hygiene practices may be considered good habit by the society, while the neglect of hygiene can be considered disgusting, disrespectful, or threatening. Hygiene activities can be grouped into the following: home and everyday hygiene, personal hygiene, medical hygiene, sleep hygiene, and food hygiene. What do you mean by personal hygiene? Personal hygiene means maintaining the body cleanness. It's personal hygiene. Home and everyday hygiene consist hand washing, respiratory hygiene, hygiene in the kitchen, bathroom, toilets, laundry hygiene, medical hygiene at home, disinfectant and antibacterial in home hygiene, and hygiene in low and middle income countries. Personal hygiene and sleep hygiene. First of all, we take personal hygiene. Regular activities include showering or bathing regularly, washing hand regularly, and especially before handling food, washing scalp hair, keeping hair short or removing hair, wearing clean clothing, brushing teeth, cutting fingernails, beside other practices. These are the regular activities which should we do for personal hygiene. Hygiene of internal ear canal means excessive cleaning of the internal ear canal can result in infection or irritation. So yes, we have to maintain hygiene of internal care, but we should keep in mind that excessive cleaning can result in infection or irritation. So whenever you clean, just take proper measures. Oral hygiene, brush twice a day softly with the correct technique, replacing the toothbrush every few months or after a bout of illness. Sleep hygiene. Sleep hygiene include establishing a regular sleep schedule, using nap with care, not exercising physically or mentally too close to bedtime, limiting worry, limiting exposure to light in hours before sleep, getting out of bed if sleep does not come, and not using the bed for anything but sleep, and avoiding alcohol as well as nicotine, caffeine, and other stimulate in the hours before the bedtime, and having a peaceful, comfortable, and dark sleep environment. Medical hygiene and food hygiene. Medical hygiene meaning is isolation or medical hygiene is very important in this COVID time, because in COVID time we learn so many words like quarantine, like isolation. So medical hygiene is very important term. Isolation of infectious person or material to prevent spread of infection, sterilization of instrument used in surgical procedure, proper bandaging and dressing of injuries, safe disposal of medical waste, disinfection of reusable, scrubbing up, hand washing, especially in operating room, and ethanol based sanitizer. We know about sanitizer we used so much in this COVID protocol. Alcohol based sanitizer means ethanol based sanitizer. Food hygiene, handling, preparation, and storage of food in ways that prevent foodborne illness. Hand washing. For hygiene, it is very much mandatory. Regular hand washing is one of the best way to avoid spreading communicable disease. The Center for Disease Control and Prevention trusted source recommended washing the hand at certain time before, during, and after preparing food, before eating food, before and after looking after anyone who is vomiting or has diarrhea, before any and after treating a cut or wound, after going to the bathroom, after changing diaper or cleaning up a child who has used the toilet, after blowing the nose, coughing or sneezing, after touching garbage or dirty surface or object, and after handling pet or pet related items such as food. And one more important thing is before you are going to wear mask, you should hand wash, and after removing mask also you should hand wash. Wet the hand with clean running water, then turn off the tap and apply soap. Lather the hand by rubbing them together with the soap, remembering to reach the back of the hand between the fingers and under the nail. Scrub the hand for at least 20 seconds, which a person can time. Rinse the hands well under clean running water. Dry the hand using a clean towel or aid dry them. These are the 7 steps to hand washing. First, rub palm together. Then, second step is rub the back of both hands. Then, third step, interface finger and rub hands together. Then fourth step is interlock fingers and rub the back of the fingers of both hands. Fifth step is rub thumbs in a rotating manner, followed by the area between index finger and thumb of both hands. Sixth step is rub fingertips on palm of both hands and clean by this. Teaching children hygiene. Parents and caregiver should teach children how to keep themselves clean from a young age. For example, they can start using toothpaste to brush a child's teeth when they reach the age of 12 months. When the gaps between a child's teeth close, it is important to start flossing. Encouraging children to help clean themselves as soon as they are old enough is a good way to initiate a proper personal hygiene routine. Factors that negatively impact hygiene. Poverty and lack of access to clean water can both have a detrimental effect on a person's personal hygiene. A person's mental health can also affect how they take care of themselves. People who are living with certain conditions such as psychotic disorder, severe depression, or drug or alcohol use disorder may find it very difficult to keep up a personal hygiene routine. While personal hygiene can cause certain health issue, it can also be a side effect of some of them. People living with Alzheimer's disease. Alzheimer's disease is a disorder of old age, maybe after 65 or 70, in which persons is having dementia or he can forget the things, routine things also. So he started to forget the things. So people living with Alzheimer's disease and other type of dementia often have poor oral hygiene trusted source. In some cases, the inability to maintain a hygiene routine could result from depression. Depressive symptoms such as reduced energy level and impaired cognitive function can make a self-care regimen more difficult to keep up. Hygiene related disease. These are the few hygiene related disease like athlete food, body lice, chronic diarrhea. We all know about if we are not taking hygiene of hand and you are using food with bad after, yeah, you can say before using hand wash you are having some food, so you can have stomach upset resulting in diarrhea or chronic diarrhea. It also results in tooth decay, head lice, hot tub rash, pinworm, pubic lice, scabies, swimmer's ear, and ringworm. Hygiene routine tips. It helpful tips for creating a hygiene routine include the following. Make it a habit. With daily practice, a new habit can become a regular part of life. Choose one area to focus on and practice until it becomes a second nature. Set reminder. Using the Notes app on a cell phone can be a great way to avoid forgetting any task. Use rewards. This thing is very much beneficiary in case of children. If you want to teach something good to children, use rewards. Means if he doing something good, appreciate it by any kind of rewards. So a sticker chart can be a brilliant incentive for children to maintain their personal hygiene. Invest in nice toiletries. Using products that smell good may encourage some people to stick to their personal hygiene routine. Keeping the body clean has a positive effect on a personal social life and their physical and mental health. Personal hygiene is simply looking after the body and keeping it clean and healthy. Developing and maintaining a personal hygiene routine is key to having a healthy body and a mind. Now we are, these are the basic of health and hygiene we can learn. Now, in this COVID time, we have to understand something about COVID. So, we are going to discuss something about COVID. Okay, how can you prevent by taking some precaution from COVID, and what kind of mask we should use, and how to clean these masks after use. So, we are going to discuss some points about this. So, how to protect yourself and other? Protect family member. Some member in your family may need to continue to take a step to protect themselves from COVID-19, including anyone not fully vaccinated, including children in India less than 18 years of age who are not eligible for COVID-19 vaccine is still people with weak immune system or underlying medical condition. So first of all, what can we do from to affect from COVID? First of all, we do get vaccinated. If you are eligible for vaccination, first thing you do to take vaccine. Authorized COVID-19 vaccine can help protect you from COVID-19. You should get a COVID-19 vaccine as soon as you can. Once you are fully vaccinated, you may be able to start doing something that you had stopped doing because of the pandemic. And government is also planning to vaccination of children less than 18 year of age also. Okay, so whenever you get a chance or your children get a chance, make them vaccinated. Second, wear a mask. So everyone 2 year or older who is not fully vaccinated should wear a mask in indoor public place. I used public place. So in every public place you should use mask, because everybody is know that we are reading something about Omicron strain also. So in case of Omicron, there is no such data available that the previous vaccine which have received by all of us is fully beneficial on Omicron or not. So first safety measure is wear a mask. If you are having a mask, then the chances of COVID infection is reduced by so much percentage. So in general, you do not need to wear a mask in outdoor set. If you're alone in an indoor room, that then you are not allowed or not, then you are not need to require a mask. People who are having a condition or taking medication that weaken their immune response may not be fully protected even if they are fully vaccinated. So they should continue to take all precaution recommended for unvaccinated people. If you are fully vaccinated, to maximize protection and prevent possibly spreading COVID-19 to other, wear a mask. And this thing actually some time ago, so now because of Omicron, whether you are vaccinated or not vaccinated, you have to use mask. You know, there is no thing in this. Why should we wear masks? Masks are a key measure to suppress transmission and save life. Masks should be used as a part of a comprehensive do it all approach, including physical distancing, avoiding crowded, closed and closed contact setting, good ventilation, cleaning hand, covering sneeze and cough, and more. Depending on the type, mask can be used for either protection of healthy person or to prevent onward transmission. Stay 6 feet away from others. Inside your home, avoid closing contact with people who are sick. If possible, maintain 6 feet distance between the person who is sick and other household members. And if you are talking about outside your home, remember that some people without symptoms may be able to spread virus. So always wear mask, because we don't know that who is having COVID infection. So we have to maintain our hygiene, our health safety is first. Who should wear what kind of mask? This is also an interesting question. There's so many masks we are talking about, like cloth fabric mask. We are talking about medical masks. In these, there is a surgical mask and N95. You have also seen FFP mask written on so many masks. So who should wear what kind of mask? First, medical masks are recommended for health workers in clinical setting. For anyone who is feeling unwell, including people with mild symptoms such as muscle ache, slight cough, or sore throat or fatigue, should use medical mask. Medical mask term include surgical mask. Three-layer surgical mask is more beneficial. Anyone awaiting COVID-19 test result or who has tested COVID positive should wear a medical mask. People caring for someone who is a suspected or confirmed case of COVID 19 outside of health facilities should wear a medical mask. Medical masks are also recommended for the following groups because they are at higher risk of becoming seriously ill with COVID 19 and dying. People age 60 or over, people of any age with underlying health condition, including chronic respiratory disease, immunocompromised patient, and diabetes mellitus patient. Non-medical and fabric masks can be used by general public under the age of 60 years and who do not have underlying health conditions. Now we are talking about fabric mask. Means cloth mask. How should I wear and clean fabric mask? Because so many persons we are using cloth mask. So first of all, how to put and wear a fabric mask? Before touching the mask, clean your hand with alcohol-based hand rub or soap and water. Inspect the mask for tear or holes. Do not use a mask that is damaged. Adjust the mask to cover your mouth, nose, chin, and leaving no gap on the side. Place the strap behind your head or ear. Do not cross the strap because this can cause gap on the side of your face. Avoid touching the mask while wearing it. If you touch it, then clean your hand. Change your mask if it gets dirty or wet. Now the most important question is how to take off and store a fabric mask. First of all, clean your hand before taking off the mask. Take off the mask by removing it from the air loop without touching the front part of the mask. This is most important line. Do not touch front of the mask because if you have come to contact to a COVID-19 patient or a suspected COVID-19 patient, your mask front part is also having some viruses on it. So if you are touching it, that's not good for you. If your fabric mask is not dirty or wet and you plan to reuse it, put it in a clean plastic resealable bag. If you need to use it again, hold the mask at the elastic tube when removing it from the bag and clean your mask once a day and clean your hand after this procedure also. How to clean a fabric mask? Wash fabric mask in a soap or detergent, preferably hot water, at least 60 degrees centigrade, at least once in a day. If it is not possible to wash the mask in a hot water, then wash it in soap or detergent and room temperature water, followed by boiling the mask for 1 minute. General tips for it is make sure to clean your hand before touching your mask. Make sure you have your own mask and do not share with others. Resist the temptation to pull down your mask to your chin or take it off when speaking to other people. Do not store your mask around your arm or wrist or pull it down to rest around your chin or neck. Store in a clean plastic bag. Now the next step is how should I put on or take off a medical mask? So first of all, how to put on. Before touching the mask, clean your hand with alcohol-based hand rub or soap and water. Inspect the mask for tear or hole. Do not use a mask that has previously been worn or damaged. Verify which side is at the top. This is usually where the metal strip is. In case of N95, we see there is a metal strip. This is the top side of it. Then identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure that there are no gap between your face and mask. Place the strap behind your head or ears. Do not cross the strap because this causes gap on the side of the mask. Pinch the metal strip so it mold to the shape of your nose. Remember, do not touch the front of the mask while using it. Avoid contamination. If you accidentally touch it, clean your hands. And how to take off a medical mask. Before touching the mask, clean your hand with an alcohol-based hand rub or soap and water. Remove the strap from behind the head or ear without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for a single use only. Discard the mask immediately, preferentially into a closed bin. Clean your hand after touching the mask and be aware of the condition of the mask. Replace if it is gets soiled or damp. Medical masks, also known as surgical masks, are composed of three layers of synthetic non-woven material configured to have filtration layer sandwiched in the middle. Available in different thickness, have various level of fluid resistance and filtration. Respirators, also known as FFP, filtering phase piece respirator, are available at different performance levels such as FFP2, FFP3, N95, and N99. Medical mask and respiratory mask are similar in their protection value. However, respirators are specific for certain procedure and instant because they have a tightly fitted component to them. Respirator masks are designed to protect healthcare workers who provide care to COVID-19 patients in settings and areas where aerosol generating procedures are undertaken. Healthcare workers should be fit tested before using a respirator to ensure that they are wearing the correct size. Wearing a loose fitting respirator will not offer the same protection to the wearer and may allow a small particle to get inside and mask through the side. So this is all about the some mask. Now we are talking about some precautionary measures also about COVID, others precautionary measures. First of all, test to prevent spread to others. Testing can give you information about your risk of spreading COVID-19. You can choose from many different types of tests. Regardless of the test type you select, a positive test result means that you have an infection and you should isolate and inform your close contact to avoid spreading disease to the other. Over the counter self test can be used at home or anywhere. They are easy to use and produce rapid result. Anyone can use self-test regardless of vaccination status or whether they have symptoms or not. Consider using a self-test before joining indoor gathering with others who are not in your household. A positive self-test result means that you have an infection and should avoid indoor gathering to reduce the risk of spreading disease to someone else. A negative self-test result means that you may not have an infection. Repeating the test with at least 24 hours between tests will increase the confidence that you are not infected. Ask your healthcare provider if you need help interpreting your test result. Then we already discussed about washing of the hand. In case of COVID-19, we take some point about wash your hands. Wash your hand often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing or sneezing. It is especially important to wash your hand before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing or sneezing, after handling your mask. These are other points you should do. Cover cough and sneezes always. If you are wearing a mask, you can cough or sneeze into your mask, but then you have to change it, your mask. And if you are not wearing a mask, always cover your mouth and nose with a tissue when you cough or sneeze, and use the inside of your elbow and do not spit. Throw used tissue in the trash. Immediately wash your hand with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hand with a hand sanitizer that contain at least 60% alcohol. Clean and disinfect. Clean high touch surface regularly or as needed and after you have visitors in your home. This include table, doorknobs, light switches, countertops, handles, desk, phones, keyboard, toilets, faucet and sink. If someone is sick or has tested COVID positive for COVID-19, disinfect frequently touch surface. Use a household disinfectant products. Basically, if a person of COVID-19 recovered, then you have to disinfect all his used items, whether his bed sheet, bed, pillow cover, and everything. And there is, for floor cleaning, we have to use sodium hypochlorite. Sodium hypochlorite is mainly used to disinfect in these COVID-19 time. If surfaces are dirty, clean them using detergent and soap and water prior to disinfection. Monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, and other symptoms of COVID-19. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercise. This is important point. If you take your temperature within 30 minutes of exercise, many times it is falsely raised. So don't take your temperature within 30 minutes of exercising or after taking medication that could lower your temperature, like acetaminophen, like means like paracetamol. Monitoring symptom is especially important if you are running errands, going into the office and one place, and in setting where it may be difficult to keep a physical distance of 6 feet. Now we will know more about the different aspects of health. We have seen something about COVIDs. Now we will try to know something about aspects of health also. So everybody is talking about health. Whenever we go outside, everybody is talking about health, that mental health, physical health, social health. So question, there are 10 aspects of health. First of all, like physical health, then there is emotional, purposeful, environmental, occupational, nutritional, physical, intellectual, social, and spiritual. These are the 10 these are the 10 aspects of health. How to now the question arises, how to stay healthy, how to improve your health, how to be more health conscious. But the problem is, all too often the topic of health only focus on couple of areas, mainly physical and nutritional. But when you think about the concept of overall health, you have to consider all the different aspects that contribute to good health. So today we are going to share 10 these health aspects of health. When we grow and nurture these different areas, we will in turn develop healthier habits and a more balanced lifestyle. It is important to note that the health is more all encompassing than a balanced diet and a adequate exercise. It involves stimulating your brain, feeling socially connected, practicing sound spending and budget, and feeling grounded spiritually. It is essential that we understand our health is a reflection of our overall being, not just how we look or eat. Building good, lasting habit in these different aspects of health impact our mood, satisfaction, and overall sense of purpose. So let's dive into each aspect as is relate to the overall health. First of all, we are going to discuss about social health. Social health means finding satisfying interpersonal relationship, friendship, and community. When we feel a sense of connection to our community, it gives us a sense of being known, loved, and appreciated. Practicing healthy habit in this particular aspect of health means finding people who you can do life with, people that challenge, encourage, and love you for who you are. Toxic relationships have no place in good social health. If you find yourself in a relationship or friendship that feel one-sided or unhealthy, stop back and assess where you are. Does the person make you want to be better? This is social health. Spiritual. Spiritual health is a groundness and peace between the physical and psychological. Practicing good spiritual health means knowing that you are not alone in this journey and knowing where to find peace and comfort. So healthy spiritual habit include quiet time, prayer walk, investing in knowledge, and discussing scripture with other believer. This is about spiritual health. Now, what about physical health? Physical health involve overall condition of your body in regards to exercise and lifestyle choices, body habits, sleep hygiene. It is more than just how you look. It's about the choice you make that affect your energy, stress level, and risk of disease. Cardio can help you maintain a healthy weight, decrease your cortisol level, which correlate to stress, and improve your performance during your healthy life. Good physical health has tremendous benefit for your overall health. Emotional. Emotional health involve control over your thought, feeling, and behavior. Good emotional health can lead to fruitful social and occupational health. It has repercussion for a variety of areas in our life. I find that often absence, I'm not tending to my emotion as I should. It's easy to disregard our feelings in a world. So emotion can often be viewed as a weakness when in fact they are important road sign we need to pay attention to. Knowing why you feel the way you feel and acting appropriately in response to that feel lend to a healthy behavior and action. Then what about purposeful health? Purposeful health means we need purpose, plain and simple. Depression and anxiety can run rampant when our sense of purpose is lost. So what does purposeful health look like? Many times it plays a significant part in occupational, spiritual and emotional health. Now, environmental health. This may be the most challenging aspect of health to explain. Environmental health encompasses all the different areas of environment that have an effect on your quality of life and general health. This may include air quality, food source quality, water source, chemical exposure, and cleaner living. There's been an incredible push in the beauty, food, and lifestyle industry over the past few years to provide general public with more products that are environmentally conscious. Good environmental health equate to deeper understanding of what you are consuming, using, and buying, and how it affects your body and the world at large. Now we are discuss about occupational health. Occupational health is closely linked to purposeful health. It involves healthy work relationship and adequate work opportunities based on your skill set and a general sense of protection or safety in your workplace. So good occupational health makes way for good social, emotional and purposeful health. Now we are going to discuss about nutritional health. Talking about intellectual. What we understand about intellectual health. Intellectual growth should commence at birth and cease only at death. This thing is said by Mr. Albert Einstein that intellectual growth should commence at birth and it only cease at death. So absolutely, we need mental stimulation not just when we are children, but also when we are adolescent, adult, and aging. Good intellectual health lends itself to lifelong learning, which include reading, writing, educating, and studying. We should never tire of learning and growing in our knowledge. Honestly, we should always be striving to learn and grow in our understanding of this world. And what about fictional health? Fictional health involve spreading, saving, and budgeting. When we use our resources with wisdom and integrity, oftentimes we will experience peace and security. Knowing when to invest, spread, and save can have major implication on our emotional and spiritual health. So now, in discussing these 10 aspects, I am by no means asserting I am expert in overall health. I strive to maintain a balanced, healthy lifestyle, but some days are better than others. So this is the 10th point we have discussed. Now we are actually there is a very important point like mental health. We are talking so much about physical health, but mental health is very much important nowadays because there are so many disease or so many condition you can say that affecting the person because of his mental status. So we are going to discuss something about mental health. Mental health refers to the state of mind, body, and emotion that is associated with well-being. It is a state of well-being that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a state of mind that is not only physical but also mental. It is a s how people think, feel, and behave. People sometimes use the term mental health to mean the absence of mental disorder. Mental health can affect daily living, relationship, and physical health. However, this link also work in other direction. Factor in people life, interpersonal connection, and physical factors can all contribute to mental health disruption. Looking after mental health can preserve a person's ability to enjoy life. Doing this involve reaching a balance between life activities, responsibilities, and efforts to achieve psychological resilience. Conditions such as stress, depression, and anxiety can all affect mental health and disrupt a person's routine. Although the term mental health is in common use, many conditions that doctor recognize as psychological disorder have physical root also. So risk factors for mental health condition. What are the risk factor? Everyone has some risk of developing a mental health disorder, no matter their age, their gender, their income, or their ethnicity. In much of the developed world, mental health are one of the leading cause of disability. In case of our country, we are talking that we are in developing countries and we are not taking consideration of so much about mental health. We are not discussing about mental health. We don't want to go to a psychiatrician because there is a thing that if you go to psychiatrician then you are mentally unstable. There is a difference between mentally unstable or you can say mentally patient. There is so many synonymous words we can use. So in my opinion, if you are having any kind of stress or anxiety, first of all you use your family environment to overcome it. Use your family, use your friends, and you're still having difficulty, just consult with psychiatrician. They are they are the professionally trained persons to help you. So please take help from them. Social and financially circumstances, biological factors, and lifestyle choices can all shape a personal mental health. A large proportion of people with a mental health disorder have more than one condition at a time. It is important to note that good mental health depends on a delicate balance of factors and that several elements of life and the world at large can work together to contribute to disorder. The following factors may contribute to mental health disruption. First is continuous social and economic pressure. Having limited financial means or belonging to a marginal or persecuted ethnic groups can increase the risk of mental health disorder. Economic pressure can also lead it. Common mental health disorders. The most common type of mental illness are anxiety disorder, mood disorder, and schizophrenia disorder. Anxiety disorder. According to the Anxiety and Depression Association of America, anxiety disorder are the most common type of mental illness. This is the most common type of mental illness. Many people misunderstand this phobia is a fear of being out. So this, sorry, actually, okay. So this is about the anxiety. We're talking about three words: anxiety, mood disorder, and schizophrenia. These are the common mental illnesses. You know, anxiety means you are having exaggerated your things. You know, you are anxious. Mood disorder, we can take a mood disorder one by way. Okay. So first of all, what are the anxiety disorder? Anxiety disorder is OCD. OCD is an anxiety disorder. People with OCD means full form of OCD is obsession compulsive disorder. In simple language, you have seen so many persons who are repeatedly do a work like just cleaning this laptop one time, then two time, three time, or checking the door lock time after time. They will check the door the 10 to 20 times. So this is a type of OCD. So people with OCD, obsession compulsive disorder, have obsession and compulsion. In other words, they experience constant and stressful thought and a powerful urge to perform repetitively act such as hand washing. Also it is also a type of OCD, that you are washing your hand, saying that 20, 30, 40 times in a day after every activities. So this is also a thing. Now, post-traumatic stress disorder. Post-traumatic stress disorder can also occur after persons experience or witness a deeply stressful or traumatic event. During this type of event, the person think that their life or other people life in danger, and they may feel afraid or what they have no control over what is happening. So this is also a type of anxiety disorder. Now we are talking about mood disorder. People may also refer to mood disorder as affective disorder or depressive disorder. People with these conditions have significant changes in mood, generally involving either mania, which is a period of high energy and elation. This is about mania. What do you understand by mania? Mania means there's a opposite of depression, that you are highly energetic. Every time you are highly energetic. So this is, you can say, mania. And the other, what about bipolar disorder? There's a term like bipolar disorder. Bipolar, by the word you are understanding, bi means two. So a person with bipolar disorder experience unusual changes in their mood, energy level, level of activities, and ability to continue with daily life. Means one time they are at high at their mood, and the next time they are very low at their mood. So these are the changes, means bipolar activities. Period of high moods are known as manic phase, while depressive phase bring on low moods. Seasonal affective disorder. Reduced daylight trigger during the fall, winter, and early spring month trigger this type of major depression. So there is a term like season wise disorder. So seasonal affective disorder means whenever the daylight reduced, like in winters or early spring month, it triggers this type of major depression. It is most common in countries far from the equator. This is seasonal affective disorder. Now, let us discuss about schizophrenia disorder. Mental health authorities are still trying to determine whether schizophrenia is a single disorder or group of related illness. It is highly complex condition. Of schizophrenia typically develop between the age of 16 and 30 years. The have thought that appears fragmented, and they may also find it hard to process information. Schizophrenia has negative and positive symptoms. Positive symptoms include delusion, thought disorder, hallucination. Means a schizophrenic person is believing in things which are not there, is believing that there is somebody is outside or somebody is walking in front of me, but there is no one there. So these are the symptoms of hallucination a person of schizophrenia having. And negative symptoms of schizophrenia patient is withdrawal, lack of motivation, and flat or inappropriate moods. Lack of motivation means he doesn't have any motivation to do any work, and he's having withdrawal, means if you are giving him any work, he'll take it, then he withdraw it. So these are the symptoms of schizophrenia patients. There is also a signs of schizophrenia patient. We were going to discuss about the signs of schizophrenia patient. There is no physical test or scan that reliably indicate whether a person has developed a mental illness. We are taking about sign of mental illness, overall mental illness, not about schizophrenia, overall mental illness. However, people should look out for the following as possible signs of mental health disorder. These are the signs: withdrawing from friends, family, and colleagues. The person is in regular contact with his friends, his family, and his colleagues, suddenly is making distance with all of them, avoiding activities that they would normally enjoy, sleeping too much or sleeping too little, eating too much or eating too little, feeling hopeless, having consistency low energy, using mood altering substance including alcohol and nicotine more frequently, displaying his negative emotions, means he's displaying about the negativity of the life much more than the positivity, being confused so much, he's confused in every work, being unable to complete daily tasks such as getting to work on or cooking a meal, having persistent thought or memories that reappear regularly, thinking of causing physical harm to themselves or others, hearing voices, and experiencing delusions. Experiencing delusions. There are various methods for managing mental health problems. Treatment is highly individual, and what works for one person may not work for another. This is the part of mental health problem treatment, that there is a treatment who can work for one person and may not work for other person. So strategies are different for every patient. Some strategies or treatment are more successful in combination with other. A person living with a chronic mental disorder may choose different options at various stages in their life. The individual need to work closely with a doctor who can help them identify their need and provide them with suitable treatment. What are the treatment we can use? Psychotherapy approach to treating mental illness. Cognitive behavior therapy, exposure therapy, and dialectical behavior therapies are the example. Psychiatrician, psychologist, psychotherapist, and some primary care physician carry out these type of treatment. It can help people understand the root of their mental illness and start to work on more healthful thought pattern that support everyday livings and reduce the risk of isolation and self-harm. What are the medication we can use? Some people take medications such as antidepressant, antipsychotic, and anxiolytic medications we can use. Most important in mental disorder is self-help. You have to help yourself. A person coping with mental health difficulties will usually need to make changes to their lifestyle to facilitate wellness. Such changes might include reducing alcohol intake, sleeping more, and eating a balanced and nutrition diet. People may need to take time away from work or resolve issue with personal relationship that may be causing damage to their mental health. People with conditions such as anxiety or depressive disorder may benefit from relaxation technique, which include deep breathing, medication, and mindfulness. Having a support network, whether via self-help group or close friends and family, can also be essential to recovery from mental illness. So now, due to shortage of time, I will like to discuss how to manage mental health in COVID area, because this time I'm taking so much time on COVID because this is the thing we all are watching in our surrounding. So we have to know about these COVID things. So managing mental health in COVID era. During a crisis such as the COVID-19 pandemic, it is common for everyone to experience increased level of distress and anxiety, particularly as a result of social isolation. Physicians and other frontline healthcare professionals are particularly vulnerable to mental health effect as they strive to balance the duty of caring for patients with concern about their own well-being and that of their family and friends. Use the strategies and resources to manage your own mental well-being while also caring for patients during the pandemic or any other crisis. Take care of yourself. Airlines safety briefing remind us to put on our own oxygen mask, help to other in the event of emergency. So this is the first thing in COVID. First, help yourself. Attending to your mental health and psychological well-being while caring for patient is as important as managing your physical health. Feel free to feel your feelings. You and your colleague are likely to feel immense pressure given the potential surge in care demand, risk of infection, and equipment shortage, among others. Perform regular check-in with yourself. Monitor yourself for symptoms of depression, stress disorders such as prolonged sadness, difficulty sleeping, intrusive memories, and feeling of hopelessness. Talk to a trusted colleague or supervisor. Be open to seeking professional help if symptoms persist or worsen over time. Take break from the news and social media. This thing we have to do in this COVID protocol also, that just take some break from the negative news of social medias also. Make a regular habit of stepping away from your computer and smartphone from time to time. Whether returning online, focus on information from reputable source, not just source in your social media feed. You don't have to take in everything produced by 24/7 news cycles. Be fortified by remembering the importance and meaning of your work. Remind yourself that despite the current challenges and frustration, your work is a noble calling. Taking care of those in need in a time of great uncertainty. Make sure to take time to recognize the effort and sacrifice made by your colleagues. Together, we all are stronger in this mental health. Take care of your staff and surrounding too. Leadership should strive to maintain critical infrastructure and other support in place for staff during this time, knowing that this may require modification to existing strategies, tactics, and rules. So adjust staff procedure and schedules. Provide clear and understandable communication to patient. Incorporate guidance about stress into general care patient. Emotional distress and anxiety are the common during pregnancy and delivery. Acknowledge that stress exists and help normalizing it. Basic strategies can be used to teach them how to recognize sign of distress. And when discussing ways to reduce them, additional form of treatment such as cognitive behavior therapy can also be effective. Now, the final thing is, what are the 10 lifestyle goals for healthy living? We have to discuss it. First, points like get adequate rest daily, get regular physical activity, eat more plant based food, eat more whole grain breads and cereals, choose healthy fats, achieve maintain a healthy weight, be free of dependence on tobacco, illicit drug or alcohol, maintain a cheerful and hopeful outlook on life, spend quality time with family or friends, and take time daily for spiritual renewal. So we are taking one by one all these points. First, get adequate rest daily. People with the best health and longevity get at least 6 to 8 hours of sleep daily. So this is sleep actually is a very compulsory thing for your health. It help in your physical health also, and it help your in mental health also. There is so many mental disorder you can connect it with the lack of sleep. So sleep should be a proper sleep, and we are not talking about that a person is going to bed at 10 o'clock and is get up from the bed at 8 o'clock, so you can say 8 hours sleep. No, for a sound sleep, when you get on the bed, there is no phone, there is no TV, there is nothing else. You have to be a proper sound sleep. For a good mental health, you need proper sleep. So taking time for daily relaxation and recreation is also helpful to the body and mind. So for this, if we are talking about relaxation and recreation, so there's so many things like yoga we can use to maintain relaxation of our body. Second point of our 10 lifestyle goal is get regular physical activity. Aim for 30 to 60 minutes of physical activity on most, preferably all days of the week. And if you can't do all days of the week, try to do alternative days as much as you can. Include strength exercise 2 times per week to maintain a healthy lean body weight. Eat more plant-based food. This thing differ for different person, but aim for at least 5 serving of fruit and vegetables daily. Limit fat means try to limit bad fat, like high cholesterol foods, you have to limit it. Use nuts, peas, beans, and soya foods are good source for plant protein. If we are talking about proteins, for a normal healthy person, daily need 1 gram per kg body weight protein. So assume if your weight is 70 kg, for a normal healthy living, you need 70 gram of protein. So you have to assess yourself that am I taking sufficient protein according to my body weight? So if you are not, try to include protein in your diet. If you are vegetarian, try to include pulse in your diet, like soya bean in your diet. And if you are can take egg, that very beneficial for you. So try to use protein as much as you can, at least 1 gram per kg body weight. And if you are exercising, going to gym, then you have to use at least 1.5 to 2 gram per kg body weight. It means if you are weighing 70 kg, then you have to take 100 to 140 gram protein daily. These are the things. The third thing is, fourth thing, sorry, eat more whole grain and cereals. So aim for at least 3 servings of whole grain daily, including brown rice and oatmeals. Limit highly refined cereals such as white bread, pastry, white rice, and sugary cereals because they all are having more unsaturated fat. These are not beneficial for us. Choose healthy fats. Choose unhydrogenated vegetable oils and trans fat free margarine in place of animal and solid fats such as butter and shortening. Eat at least 1 serving of nuts daily. Eat food high in omega 3 fatty acid such as flax meal, walnuts, soy, and soy oil. Achieve and maintain a healthy weight. A BMI is less than 25 is ideal. Now, how to calculate BMI? BMI means you have to calculate kg per meter square. So just put your weight in kg divided by your height in meter square. So you can see that if your weight is 80 kg and your height is 1.5, so you can say 80 divided by 1.5 square. And if you are having this value less than 25, so your weight according to your height is ideal. A BMI of more than 25 to 30 means you are overweight. Can't say obesity, but overweight. But a BMI of more than 30 indicate obesity. And now you are having a high risk of develop disease we can have with obesities. A waist girth less than 37 inch for men and less than 32 inch for women is ideal. But a waist girth of 40 plus inches indicate high risk for men and 35 plus inches is high risk of women. Be free. The next point is be free of dependence of tobacco, illicit drugs, or alcohol. You will surprise to know that 85,000 people die prematurely every year due to alcohol, and over 4 lakh people die prematurely every year because of smoking. So drug use can lead to dependency that can destroy physical, mental, and spiritual health. So try to limit them. It's not easy to suddenly stop alcohol or smoking, but try to limit them. Try slowly to limit them and stop them. Maintain a cheerful, hopeful outlook on life. The next point is this: choose to see the bright side of life. Be happy, laugh a lot, pass on joy and hope to those you work and live with daily. Next point is this: spend quality time with families or friends daily. Supportive relationship build strong hearts and happy mind. Practice a spirit of friendship, love, and acceptance, and share a kindness with someone you live or work with daily. Next point: take time daily for a spiritual renewal. Plant a quiet time each day to read, pray, meditate, and seek a spiritual renewal. A heart primed with gratitude, forgiveness, and so help you soar over life difficulties and challenges. So these are the lifestyle goals for healthy living. We have to take things. Now we will discuss thing to be stop to be healthy. First of all, stop these things. First point: if you want to be healthy, Stop comparing yourself to others. This is the most important thing for your mental health also. People in this life are actually started to compare, and this thing start from your schooling point of view also, when our relative or parents start to compare with your result with others. So this can lead to actually mental problem. And we are watching so many, we are reading so many things in newspaper about this thing, that in a class of 10th or 12th, they are a student before exam or after exam getting so many under pressure and doing a things which they should not supposed to do, but they are doing. So stop comparing yourself to other. Creating unrealistic expectation from yourself, this is also a very important point. Yes, we have to expect so much thing from ourselves, and our parents or relative are expecting so many things, but there is a thing that realistic expectation should be there. Now, there is no unrealistic expectation, because if you unrealistically expect from yourself, or your relative unrealistically expect from yourself, this will create pressure on your mind, and this will reduce or hamper your ability to do better in life. So not do unrealistic expectation. Help confidence, but don't be overconfident in this life. Third most important point in this time is social media obsession. The main problem actually we are facing in this mental health is social media obsession. Whatever we think, we whenever we open our social media, we saw so many negative thoughts in it. So these negative things are creating problems. So try to be positive, try to read as much as positive things you can, and stay away from negative thoughts. The fourth point is bad spending habits. Means with less income, we are trying to spend more. This also create problems in your health, because yes, initially you can have that person is having loan or having something spending money, but at the end, when pressure increases of this is also affect your health. So please stay away from this also. And fear of unknown, living in the past. Don't live in the past. And every day is a good day. Try to be better from your next yesterday. So try to be better every day. And just my last sentence for yourself: put off a vacation if you are having any mental health issue. So thank you so much for all of